Well, joining us now for our In Focus Health segment is reporter Linord Moudou, and she's going to tell us about why it takes so long to make vaccines, right?
That's right, Dimiaki. Well, vaccines have long been used to protect adults and children from contracting diseases such as polio and measles. Here is a look at the development of a vaccine. Vaccines are medicines that contain a preparation of weakened or dead microbes of the kind that cause a particular disease. They are administered to stimulate the immune system to produce antibodies against that disease. Developing a vaccine is a very complex process. Dr. Peter Hotez is with the Sabin Vaccine Institute.
You know, the needs are pervasive. So clearly large-scale research support is needed, but there's also a lot of complex science that has to be done. So you need sophisticated laboratories, and then you also need a partner that's actually going to manufacture the vaccines under what we call good manufacturing practices.
Recently, health specialists gathered at the U.S. Congress to look at public-private partnership to develop cost-effective vaccines. The briefing was organized by Research America, the Global Health Council, and PATH. Smita Barra is with the Global Health Council.
I wanted to show that research and development, more broadly, is a necessary and key intervention in global health. Particularly within that, vaccine development and research is essential, as it has made a lot of contributions already to date in improving children's lives.
Developing a vaccine requires years of research. To date, no effective HIV vaccine has been released despite many years of trials and errors. Experts say the search for a vaccine against HIV has been hampered by the virus's ability to mutate rapidly. Several HIV vaccines trials are taking place around the world. Other vaccines on trial include one for tuberculosis in a search for an alternative to the widely used BCG vaccine. Dr. Lois Barker is with the nonprofit TB vaccine research organization, ARIS.
There are actually several that are on trial, but one is quite advanced in a trial in infants outside Cape Town. It's a trial that will give us the first indication of whether the vaccine will produce some improved protection over BCG.
A new vaccine, Menafrevac, was introduced to provide childhood immunization against meningitis. Just 7 years in the making, it was successfully introduced in Burkina Faso, Mali, and Niger.
The reason that the time interval was relatively short was because much of the scientific technology that underscored the development of this vaccine was fairly well known, as differentiated with a malaria vaccine or an HIV vaccine, where there is still a fair amount of development work that needs to be done.
And joining us now in the studio to discuss children's immunization is Pegg Willingham, the Executive Director of Global Vaccines with the United Nations Foundation. Ms. Willingham, welcome to the program.
Thanks for having me, Linord.
You just returned from Mozambique, where you went to conduct a measles vaccine campaign. Can you tell us about that?
We had a wonderful trip to Mozambique to observe 3.6 million children being vaccinated against measles in only 5 days. And it was this remarkable effort by the government of Mozambique, the World Health Organization, UNICEF, and a number of private and church-based groups as well. It was really a tremendous effort.
So how is it possible to immunize so many children in such short time? What does it take?
It is really remarkable. It took 9 months of preparation, so it doesn't just happen overnight. The country applies to the World Health Organization and says, even though we've tried to vaccinate all of our children, some are in remote areas, and we really think we need to have a nationwide push. And then the World Health Organization then agrees, and the country spends months training Ministry of Health, but also thousands of volunteers.
Now, we know that vaccination is important for a child as well as an adult. Let's focus on children's immunization. Tell us about what some of the most important vaccines that children need to have, especially when they're from the age 0 to 5 years.
Well, children are especially vulnerable at that age, and unfortunately there are still 2 million children who are dying every year from vaccine-preventable diseases because they just don't have access, even though vaccines are so affordable. So measles, of course, is really important. It's the most infectious disease, really. We can see in Somalia now, for example, they're worried about this. Polio is also important because it can leave children crippled for life. Tetanus is a problem because in conditions where children are born at home and the umbilical cord is cut sometimes with not very clean instruments, they can get tetanus and die. So there are many different vaccines. One thing very exciting is that there are new vaccines for the 2 diseases that kill the most children now every year, and that's pneumonia and diarrhea. So there is some very exciting progress, but we just have to get these vaccines to the children.
Now, these vaccines that you just listed, they are not true for children maybe in the West, in the United States, or because when you talk about measles, for example, and polio, are these issues that are common here? They're not common here in the
Well,
United
we've
States.
been very lucky because of vaccines, we've managed to really push back these diseases. But a few years ago, before these vaccines came, there were serious problems here too. But once the vaccines came along, for example, measles came along in the mid-1960s. Before that, children in rich and poor countries died. Now it really is primarily in developing countries, but even there, the vaccine has really reduced the death rate. So once a country gets access to vaccines, they can all get on a level playing field.
So what do you think that needs to be done to ensure that as many children as possible get the vaccine they need? Because as of today, as you were saying earlier, there are still children that are not vaccinated.
Well, one problem is that in conflict zones, it's harder for children to get vaccinated. And for example, that's why with polio, there are only 4 countries where polio has not been, the transmission hasn't been interrupted. And Pakistan and Afghanistan border is one of those places. At the same time, money is still an issue because these new vaccines for diarrhea and pneumonia are more expensive than the older vaccines. There was recently a big push by donors to give more money for these 2 vaccines, so there is some progress coming along. Also, it can be a question of education. There are times when even in developed countries there are rumors that spread. It can also happen in other countries around the world where people have concerns about vaccines. And even though there's no scientific proof to say that these vaccines are dangerous, people will hear these rumors and decide not to vaccinate. So there are quite a few barriers left, but I think with time and education and money, we can really make a big difference.
Ms. Willingham, thank you so much for joining us today.
Thank you, Linord.
And it's time now for a break.